Hey friends, welcome to Discover Medical. In this video, we are going to discuss about peptic ulcer. Cause due to protective factor H.pylori and hydrochloric acid and aggressive factor mucus and bicarbonate. Acid in the stomach is secreted by parietal cell. Let us discuss about what the mechanism of a parietal cell. Parietal cell is also called as a oxyntic cell or a delomorphous cell. Parietal cell present in the fundus and the body of the stomach. In parietal cell, there is a proton pump which is also called as a hydrogen and potassium ATPase. Hydrogen ions pump outside and potassium ions pump inside. Parietal cells are regulated by acetylcholine, histamine and gastrin. Gastric ganglia contains M1 receptor which is very close to the parietal cell. It secretes acetylcholine. Acetylcholine acts through M3 receptor. Histamine acts through H2 receptor. Gastrin acts through cholecystokinase receptor. Acetylcholine and gastrin 50% they directly stimulate the proton pump and 50% mediated through histamine. Prostaglandins are naturally inhibit the proton pump. Firstly, we have to inhibit the process M1 receptor which stimulate the acetylcholine. We use M1 blockers, peranzapine, talanzapine. We already discussed that acetylcholine and gastrin they both 50% directly stimulate the proton pump and 50% mediated by histamine. So inhibiting the histamine, we have to inhibit the receptor H2 receptor. We're going to use a drug H2 blocker, cimetidine, ranitidine, famotidine and losartanine. We already discussed that proton pump is naturally inhibited by the prostaglandins. So the drug used here is misoprostol. Next, for a proton pump inhibitor, we use drugs omeprazole, esomeprazole, pantoprazole, lansoprazole, rabeprazole. You can note that these drugs are ending in a prazole, prazole, prazole. You can easily remember it. Let's gain some knowledge about a proton pump inhibitor. It is a drug of choice for peptic ulcer disease, Zollinger-Ellison syndrome, gastroesophageal reflux disease. It causes the side effects vitamin B12 deficiency and calcium deficiency. These are like irreversible because they will inhibit proton pump acid secretion will do not reassume till new proton pump synthesis. 24 hours required to synthesis of a new proton pump. Proton pump inhibitor do not work locally because if we give the drug through orally, it reaches the stomach. In stomach itself, it will be metabolized due to the secretion of the hydrochloric acid. So, proton pump inhibitor is given with special water soluble coating. Then it reaches the intestine and absorbed through blood vessel and reaches the parietal cell and the proton pump will be inhibited. If the patient has a burning pain in abdomen, so we have to neutralize the acid. We're going to use a drugs antacids, which is aluminium hydroxide and magnesium hydroxide. For magnesium hydroxide, it causes a side effect diarrhea. For aluminium hydroxide, it causes a side effect constipation. Ulcer protectives, which is mucus and bicarbonate, we use a drug sucralfate and colloidal bismuth substrate. Side effect leads excessive use can lead to bismuth poisoning, osteodystrophy and encephalopathy. To kill H. pylori, we use antibiotics which is amoxicillin and metronidazole, clarithromycin. Triple therapy for peptic ulcer patients. One proton pump inhibitor lansoprazole and two antimicrobial agents clarithromycin and amoxicillin. Thank you guys for watching our video. If you like the video, like, share and subscribe it.